So today we will talk about how do we identify what are the patterns. If you want to identify the patient who is a known case of rheumatology, if he is having osteoarthritis or rheumatoid arthritis and all, so we will start with it. Okay, we will study today. We will discuss about the X-rays, the signs, and what are the how do you identify the features. Okay, so the objectives of today's class is it has present several patterns of arthritis where lab and imaging fit into various patient presentation and benefit in pitfalls related to lab testing and all. So what are the patterns of arthritis? As you can see in this figure, this is a very common case of arthritis of hand. Okay, so it's typically an osteoarthritis case. There is a non-inflammatory, it is osteoarthritis, trauma or mechanical problem. The inflammatory ones are monoarthritis, oligoarthritis, and polyarthritis. Okay, so the patterns of arthritis are: first one is non-inflammatory, second one is inflammatory. Okay, in non-inflammatory, the arthritis are osteoarthritis, traumatic arthritis, mechanical problem arthritis. And then inflammatory arthritis, we have our monoarthritis, oligoarthritis, and polyarthritis. So what are the difference between inflammatory and mechanical arthritis? In inflammatory arthritis, we have immobility, stiffness. Our EMS is greater than 30 to 60 minutes. It is better with activity and non-steroidal anti-inflammatory drugs. We have joint swelling, erythema, heat. We have systemic symptoms. We have multi-organ involvement. Okay. So in mechanical arthritis, we can see that latter day, on the second day, we have our immobility or stiffness. Okay, so the EMS timing here is less than 30 to 60 minutes. It worsens with the activity. Okay, in the mechanical arthritis, if you do continually do the work and all, it getting worse and worse. Okay, then we have our instability, then we have our locking, then we have our trauma and strain overusage. So how do we determine the presence of inflammation? How do you check for the inflammation here? So the cardinal findings of inflammation, the cardinal signs of the inflammations are warmth, erythema, joint swelling, palpation, appearance, imaging, inflammatory markers, ESR, and CRP. Okay, so if you can check for the warmth, you can check for the erythema, then you can palpate the joints, you can check the appearance of the joints, then you can do the X-ray, imaging, MRI, CT scan. Then you can also check for the lab investigations of the inflammatory marker. What are the inflammatory markers in the lab investigation, pathology lab investigation? It is the ESR and the CRP. So evaluation of inflammatory polyarthritis, it involves inflammatory versus non-inflammatory. Number of joints are involved, acute versus chronic are involved, additive versus migrative is involved, persistent versus recurrent arthritis, predominantly proximal versus predominantly distal, symmetrical versus asymmetrical. Okay, so there are many types of polyarthritis, inflammatory versus non-inflammatory. How many joints are involved? It is the if many joints involved, it is polyarthritis. If some joints involved, it is monoarthritis. Okay, so as we have seen in the last, we have the inflammatory, monoarthritis, oligoarthritis, and polyarthritis. Okay, so it depends on the number of joints which have involved in that inflammation. Okay, so then we have our acute versus chronic. If the condition is acute or chronic, if the patient is suffering from that condition since 6 months or 8 months, or it is a chronic condition, if the patient is suffering from this condition since 2-3 days to a few weeks. Okay, so additive versus migrative. Okay, if the arthritis is in a single joint, then it migrate to another joint, then it migrate to another joint. Okay, and what is additive arthritis? The first joint is still, then it includes the next joint, that includes the next joint. Okay, what is persistent versus recurrent? Okay, if the arthritis is persistent, it never goes away. And it is continuously is affecting the joint. Okay, but is recurrent. In recurrent, normally the pain and the swelling and inflammation goes away. Then after a few days or few months, it come back. It is a recurrent arthritis. Predominantly proximal versus predominant distal. What is proximal? What is distal? Okay, so distal joints are which are far away from the midline of the body. Okay, and what are the proximal joints which are close to the midline of the body? Okay, so those joints which are close to the midline of the body, these are called as proximal joints, and those joints which are far away from the body, they are called as distal joints. Symmetrical versus asymmetrical joint. Symmetrical versus asymmetrical joints means if the body is having both the hands are having same arthritis, it is symmetrical. If only one hand is having arthritis and another hand is normal, it is asymmetrical. So as we can see here, the case of 42-year-old woman with a history of hand pain and swelling since 2 months. Okay. So what are the preliminary findings here? So past history include hypertension, negative for we have done the all these tests which are negative for the arthritis. The patient is having difficulty in doing daily activities. Okay, then on the physical examination we can check the joint swelling and tenderness in wrist, metacarpophalangeal joint 2 to 3 and PIP joint 2 to 4. Okay, approximately 2 to 3 metacarpophalangeal joints involved, and phalangio interphalangeal joints 2 or 4 joints are involved here. Okay, so here it is a case of arthritis. Okay, so in starting investigations are negative for the arthritis, but the patient is having difficulty in doing daily activities and all. Then what are the screening tests for suspected inflammatory polyarthritis? First screen test is rheumatoid factor, another one is CCP, third one is ANA, fourth one is ESR, and fifth one is CRP. Okay, so first when the patient come to your OPD or emergency, you go for the rheumatoid factor. Okay, if the rheumatoid factor is absent, then we will go for CCP, then we will go for ANA, then we will go for if the ESR is raised or not, if the CRP is raised or not. Okay, then we will go for initial screening serology if the rheumatoid factor is present and ANA is absent. Then second one, if the rheumatoid factor is present but ANA is also present. In the third one, rheumatoid factor is absent but ANA is present. And in the fourth one, rheumatoid factor is negative here and ANA is also negative here. Still, the patient can contact the arthritis. The patient can be case of arthritis. Okay.